September 27th, 2016 meeting of the Human Services Committee will now come to order. Will the clerk please call the roll?
Mrs. Brown? Here. Dr. Carbone? Here. Mrs. Conley? Here. Mrs. Draw? Here. Ms. Harris? Here. Mr. Hebert? Here. Ms. Cayley is excused. Mr. Lightfoot? Here. Chairwoman Taylor?
Here. Is there anyone signed up for the public forum?
There is not.
Is there anyone present who is not signed up to speak, who would like to address the committee at this time? Okay, being none, we'll go to the approval of the minutes. The next item is the approval of the minutes. You have the August 23rd, 2016 minutes before you in your folders, as well as on your tablets now. They will stand approved unless the clerk is notified of any changes by the end of the day. Excuse me. The next item on the agenda is new business. Madam Clerk.
Referral number 16-0279.
Moved by Legislator Brown, seconded by Legislator Conley. Is there any discussion? Ms. Harris?
Thank you very much, Madam Chair. I'd like to ask a question through the chair to the administration. How do you guys determine who is high risk? How are the high risk mothers are enrolled into the program?
Through the chair, the referral process, according to the national standards for a nurse-family partnership, require it to be a first-time mother, less than 28 weeks in their pregnancy, in a low-income bracket anywhere in the county, and then priority is given to such high-risk situations as chemical use, teenage, medical complications during their pregnancy.
Thank you. Through the chair to the administration, just getting some clarity, and who does the referral? Is it through the hospital? How is that process? Can you explain that to me, please?
Through the chair, we'll take a referral from anywhere. Typically, it comes from other medical providers, OBGYN offices, hospitals. There are self-referrals, there are social work referrals, there are school district referrals, our own STD clinic makes referrals. So, to the chair, to the administration, so the self-referrals could be a high-risk mother who thinks that they may meet your requirements, they can refer themselves. Is that clear? Through the chair, absolutely.
Thank you very much.
Through the chair, it seems to be a pretty large increase in the funding. Is that normal or typical?
Through the chair, I'm not sure the referral represents a true increase in funding. A few things have occurred. This is a 2-year grant, so the total amount is from October 1st of 16 through 9/30 of 18. And in the list of referrals, there is an increase of funding to accommodate New York State's failure to pass a waiver in a manner and a time frame that we could utilize the money in 2015. So they've given that back in one of these.
Legislator Harris?
Chair to the administration, has the program home visits increased or decreased over the past year?
Through the chair, the capacity of the program is also dictated by the National Service Organization. We continue to have 11.5 FTE nurses. We have had no change in that staff over the last 2 years. And they, by the program's prescription, can have a maximum of 25 clients per nurse per FTE, and we are at that capacity almost every single day.
Thank you. That clarifies. Thank you.
Any other discussion? Legislator Hebert?
Through the chair, the next two referrals as well as this one refer to 289 families, mothers, children, parents, whatever. I'm assuming all three of those are the same 289.
Through the chair, yes, all three are the funding for the nurse-family partnership. It's 289 is the maximum number of clients enrolled per our caseload capacity. However, in 2015, we had 373 persons served. People are graduating from the program, enrolling in the program, falling out of the program.
Thank you.
Any other discussion? Being none, all those in favor, please signify by saying aye. Aye. Any opposed? Item carries. Next item.
Referral number 16-0280, amend resolution.
Moved by Legislator Conley, seconded by Legislator Draw. Is there any discussion? Being none, all those in favor, please signify by saying aye. Aye. Any opposed? Item carries. Next item.
Referral number 16-0281.
Moved by Legislator Draw, seconded by Legislator Hebert. Is there any question or any discussion? Being none, all those in favor, please signify by saying aye. Aye. Is there anyone opposed? Item carries. Next item.
Referral number 16-0282.
Moved by Legislator Hebert, seconded by Legislator Carbone. Is there any discussion? Legislator Hebert, or Legislator Harris?
Thank you very much, Madam Chair. To the chair, to the administration, I'm just curious, when I was reading through this legislation here, I noticed that there's activities, outreach activities were for heterosexual individuals. Can you kind of explain to me why other individuals were singled out, other non-heterosexuals were singled out of this legislation? I just would like to know. I may have an idea why, but I'd just like to get your answer.
Through the chair, this is the designation that New York State has provided to us in this grant. It is not our designation. We provide services to all persons who access us. This is just a funding stream.
Thank you, that clarifies. To the administration, so the funding stream is, let's see, do we have a higher rate for STI, HIV, Hep C in these communities of color? Is this why this particular funding stream is designated for those populations?
Through the chair, my understanding is that's true throughout New York State, and again, this is how Albany has set up the funding, and we have successfully accessed it.
Through the chair, to the administration, what types of targeted outreach activities does this grant fund, and how do you reach these folks? How are they targeted?
Through the chair, we provide outreach services through some contracted services as well as our own staff services in high-risk settings and communities. We provide services through detox centers, drug and alcohol outpatient treatment facilities. We provided services at the homeless event in Blue Cross Arena this month. Where there are high-risk folks and they'll let us in, we'll go.
Thank you.
Is there any other discussion? Being none, all those in favor, please signify by saying aye. Aye. Any opposed? The item carries. Next item.
Referral number 16-0283, amend resolution 401.
Moved by Legislator Draw, seconded by Legislator Brown. Is there any discussion? Legislator Brown?
Chair, could you provide a summary of the STD investigation process?
Through the chair, per New York State law, all positive lab reports for any New York State reportable STI, so syphilis, gonorrhea, chlamydia, and HIV, is electronically downloaded through a secure system to us within 12 hours of the lab reporting it. Our staff take those results off all day long and assign them and work them.
Thank you.
Any other discussion? Being none, all those in favor, please signify by saying aye. Any opposed? Item carries. Next item,
Referral number 16-0284, amend Resolution 403.
moved by Legislator Brown, second by Legislator Conley. Is there any discussion? Being none? Oh, Legislator.
Chair, can you provide a summary of the types of supplies that will be purchased?
Through the chair, these would be rapid test kits, HIV, hepatitis C, and rapid syphilis testing to be used with the youth setting.
Thanks.
Any other discussion? Being none, all those in favor, please signify by saying aye. Any opposed? Item carries. Next item,
Referral number 16-0285, amend
moved by Legislator Conley, seconded by Legislator Draw. Is there any discussion? Legislator Harris?
To the administration, I'm curious, how many employees in this program are paid through this grant?
Through the chair, there are 6 employees in that section. They're all paid by the grant.
Through the chair to the administration, will this additional funding cover their salaries? Is there an increase in their salaries? How does that work with the additional funding?
Through the chair, on the additional funding, actually, we haven't figured out what we're going to do with it yet. The salaries are covered for the 5-year period of the grant, and this is additional funding that we may use to buy equipment or do things outside of what the original grant paid for.
Through the chair to the administration, so you guys, when you guys make those decisions, would you be able to let us know what that additional funding would be made towards eventually?
Through the chair, yes.
Thank you.
Any other discussion? Legislator Conley?
Thank you, Madam Chair. Through the chair to the administration, can you tell me what the employees in this program do? What's their day-to-day activities like?
Through the chair, we get referrals from the state health department on blood lead levels over 15 deciliters per decograms per liter. And what we do, we investigate where they got the blood lead poisoning. So that pretty much is what their day-to-day is. They'll go out to the house, investigate what the hazards are there, and make recommendations, and then get things fixed so they can have a lead-safe environment.
Do the investigators then go out again after they've made the initial investigation to see if the requested fixes have actually been made?
Through the chair, yes.
Thank you.
Is there any other discussion? Being none, all those in favor, please signify by saying aye. Any opposed? Item carries. Next item,
Referral number 16-0286, acceptance.
moved by Legislator Draw, seconded by Legislator Hebert. Is there any discussion? Legislator Harris?
Through the chair to, thank you, Madam Chair. Through the chair to the administration, I'm just curious, what happens to the data that we provide the state through this program, and is that data made public?
Through the chair, this contract essentially means that the state is funding part of a full full-time public health nurse to be their employee through us. The information is de-identified, so there's no connection to any specific person, and it is uploaded into the state system, and it is made public in whatever the state releases for epidemiologic data regarding HIV in New York State and Monroe County.
Through the chair to the administration, so we don't maintain any of that data locally here ourselves?
Through the chair, that is correct.
Thank you.
Legislator Brown?
Chair, is there only one public health nurse on this program?
Through the chair, that is correct.
So does the whole 400,000 go to capacity for that person?
Through the chair, my understanding is this is a revenue generating and sustaining contract for the department.
Any other discussion? Legislator Harris?
Chair to the administration, so I'm just trying to wrap my mind around the 400K. So what else does it cover besides the salary of the public health nurse?
Through the chair, the general operating expenses with the person providing the services, training and education, travel, cell phone bills, administrative costs.
Thank you, through the chair.
Any other discussion? Being none, all those in favor, please signify by saying aye. Any opposed? Item carries. Are there any other matters to come before this committee? Being none, the September 27th, 2016 meeting of the Human Services Committee stands adjourned. Excuse me, the next item, or the next meeting of the Human Services Committee will be held on Tuesday, October 25th, 2016 at 5:30 p.m.